Is it possible to add the typical backward C shape to an antihelical fold during a revision otoplasty? I had otoplasty years ago to correct protruding ears, but the surgeon didn't seem to address the shape of the antihelix, only folded the ear back, therefore creating a fold that is nearly vertical rather than backward C-shaped. I can push my ear up with one finger from the bottom, and this curve is produced. Is it possible to address this at this time, and if so, how? Would an incision-less technique work? I'm not sure if permanent or dissolving sutures were used. Thanks so much.
Thank you for your question. You submitted your question with a single photo and of your ear, and you describe in your question that you had an otoplasty performed years prior, but it appeared to you that the surgeon took care of part of the prominent element of the ear, but never addressed the antihelical fold. And you're asking if that is possible to do in revision otoplasty. Well, I can certainly share with you my approach to otoplasty and how I would suggest a solution for someone like you who would come to our practice. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Otoplasty is a significant part of the many things that we do in our practice, and I can basically, again, in the absence of a physical examination, I can tell you what the systematic approach to looking at an ear is, and then what kind of solutions there are, particularly for what you're describing. So to begin with, when you look at the ear, you look at the ear in basically thirds, an upper, middle, and lower third. And basically you're looking at the antihelical fold, you're looking at the prominence of a structure called the conchal bowl, and then you're looking at the earlobe. Now in your situation, if the ear has been brought back to a distance that is aesthetically desirable, in other words, the conchal bowl was either set back or was resected, and the distance is adequate and appropriate, well then focusing on the antihelical fold is appropriate. Now what does that mean? Well, when I do the antihelical fold procedure, it's the technique I employ is referred to as a Mustarde procedure, which is essentially the use of non-dissolving sutures through an incision made behind the ear to engage the cartilage, as well as, before doing that, creating a weakening of the cartilage in order for it to bend in a predictable and consistent way, and placing these sutures in essentially what's called a horizontal mattress fashion. It's basically creating this bend, and the sutures maintain that appearance so that the cartilage stays in place. Now, where there may be a possible need for additional procedure is that if in doing that antihelical fold or creating that antihelical fold, if the middle part of the ear looks like it's more prominent, well then you may need additional surgery for the middle part of the ear. And of course, lastly, you'd have to look at the ear lobe to make sure it's not sticking out too prominently, and a procedure for that is fairly straightforward. So I think to answer your question is, can an antihelical fold be formed? And the answer is yes. You can create an antihelical fold in isolation, in absence of doing anything else, and I would say that it is appropriate to do it in what is considered a more standard procedure, such as a Mustarde type surgery, and basically understand that when you are being evaluated, you still want to ensure that the elements of each 1/3 part of the ear is in appropriate distance from the side of the head, and so that it doesn't look like the top of the ear is folded in too much or the middle part is too out. There are sometimes when people look at themselves from the side and then they just bend the ear, they're not really appreciating how they look from either the front or the back. So you kind of have to have that discussion with your prospective surgeon. So I hope that was helpful. I wish you the best of luck, and thank you for your question.